My name is Brandon, and I'm 32 years old. I want to share this memory that I have from the time I graduated from college back in 1999. I traveled a little bit over that summer, and then I got a job at a tech startup in New York. And I felt like I was following a dream. I was moving to New York, which was really exciting. But I felt this lurking danger that if I were to become ill, get hit by a car, or anything catastrophic, I'd be putting my whole family at risk. Maybe some bankruptcy, or things that I had heard happened to people who did not have health care and had to dole out thousands of dollars for treatment. So I really just crossed my fingers because the job that I took didn't offer benefits. And my father's business had failed during the time that he put my brother and I through college, so I already had this sense that I had put the family through something financially, and I was afraid that following my dreams would possibly do irreparable damage. It was kind of scary. I went to grad school later when it was clear that there were not a lot of jobs for people in the sort of new tech economy in New York at the time. And I came out feeling really confident, got a new job, was really excited about it. The job paid more than I had made before, and the one catch was that I had to work as a contractor, so I was my own business, which to me was really cool. I paid my own taxes, but I also got to choose my own unpaid vacation days, so I felt a lot of freedom. But it turns out that you have to also pay for your own health care, and so I started asking around the office, what do you do for health care? And a lot of people that I worked with, they were young people working on a website at a big media company. They didn't pay for healthcare. They just didn't invest in it. They were in their late 20s, early 30s, and they were roughing it. I also found some people who invested in or bought into the Cobra plan, which I still don't quite understand, but I just remember finding out that the per month cost would be around $300. And in my mind, my intention was I will eventually pay for one of these plans. When I stacked that on top of student loans and the monthly cost of living in New York, it was really easy to put that commitment off. Well, one day I wake up and one of my toenails is doing the same thing that I experienced before, where I had a toenail growing kind of funky and deformed, and it was causing severe pain, and I knew I was going to have to get it removed. So I Googled or something, I think I just Googled, and I found some kind of obscure orthopedic surgery type of a place, and I called them and I asked them if they would do the procedure, and they said, yeah, sure. And it seemed like it was going to be pretty cheap. So it's some place in downtown Brooklyn. If you ever, I don't know what the place is called, but if you ever find yourself going to some orthopedic specialist whose office is only accessible from a stairwell in the back of a jewelry store on Court Street in downtown Brooklyn, don't do it. That's what I did. And I remember thinking it didn't take nearly this long for the doctor at NYU to take my toenail off as this guy was taking. And by the time the procedure was over, my foot is super wrapped up and it's bleeding profusely, and I'm thinking, man, this didn't happen last time. So I'm pretty sure I couldn't even put my shoe on. The last time I was able to walk out. This time I'm like hobbling out with a shoe in my hand, my foot's bleeding, the local anesthesia starts to wear off, and I found myself calling a friend keeled over on a sidewalk on Flatbush Avenue, please come in and pick me up because I can't walk. So 2 weeks later, I'm still hobbling. Eventually the whole thing healed, but I learned a great lesson that day about how healthcare gets rationed out based on how much you're willing or able to pay. And so I want to put my 2 cents in and say that the kind of society I want to live in is one in which the health and security of all people is equally important no matter how much money you make. Thank you.